Mm-hmm.
Good afternoon, everyone. This is Haley Love from the School-Based Health Alliance. Thanks, everyone, for joining us this afternoon. We're gonna go ahead and get started. We're gonna start with some state updates. Then we're gonna ask for committee updates and provide some updates from the School-Based Health Alliance. One of our colleagues is going to talk to you about an innovative finance case studies project we're working on. My team is going to give some updates on where we are. Andrea is going to speak a little bit about youth advisory committees, and then we're going to use the end of the call to break out into your committees for the sessions for you to talk about your specific bodies of work. So I think we'll just go ahead. Serena Clayton is unable to join us on the call this afternoon. So I'm just going to go ahead and go down the list of people on the call and ask people to share an update from their state. Anything that's interesting. It can be personal or professional. In the past couple months, you've been asked to share an awesome from your. We have some noise behind us. Excuse us. Something that's awesome that's going on personally or professionally. So I'm just going to start at the top of the list, and maybe we can kick off with Allison Kilcoyne, and you can give an update from your state and or an awesome or whatever you'd like to share.
Hello, can you hear me?
I can hear you.
Okay, great. So I'm Allison Kilcoyne up from Massachusetts. I've got one quick awesome is the Leadership Fellows were in New Orleans. We graduated. The 10 of us graduated the fellowship. So although we're still hanging around, so we had a great time in New Orleans and learned a lot. So that's a great awesome. And then as far as Massachusetts goes, I just got word probably the end of last week that our Massachusetts League of Community Health Centers is willing to be our fiscal agent for our emerging alliance here in Massachusetts. So they're willing to kind of work with us around that. So it's really exciting to have a commitment from our community health center partners.
Congratulations.
Yeah, that's great.
Yeah, it's there's still some personalities out there and still some difficulties with our former kind of coalition, but we're kind of moving forward. We've got some really about 10 really dedicated people that want to move forward. So we've got support. So it's been a long road, but we started back in January, but it's been great.
That's fantastic. So anyone can volunteer if they want to share next, or I can go down the list.
I can go next. This is Heidi, and I'm next on the list. I don't mind. Can you hear me?
Yeah. Hi.
Hi. So I'm actually here with the other person that's actually part of my good news, or awesome, is that we hired, so this is Heidi Ortelaza Alvear. I represent the Illinois School-Based Health Alliance and at EverThrive. And we just hired our new coordinator, Kristen Nye, on the call with me. So that's definitely our awesome right now. I don't know if you want to say hello. So Kristen's here. I don't know if you could hear that, but she just said hello. And statewide, I guess one of the things that continues to be a challenge, we still don't have a state budget in the state of Illinois, and our school health center grant program is about 50% funded through federal pass-through dollars and about 50% revenue that comes from the state. And so we're kind of getting at that half of the year midpoint mark where it becomes really critical for our state to hurry up and pass a budget so that we can start releasing some of the state funds to school health centers. So we're getting ready to organize around that. We're doing scheduling a few legislative site visits, and yeah, busy trying to advocate for a budget.
That's fantastic. And welcome, Kristen.
Thank you.
This is Jesse.
Anyone
I'll go next. Yeah, it's
Great.
Jesse.
Hi.
I'll go next. Can folks hear me, I assume?
We can hear you.
Okay, great. Let's see. Our awesome, things are so overwhelming in Connecticut right now. I'm glad I had a few minutes to really think about what was awesome. But we're really excited because Connecticut is one of the 4 teams that's coming to the School-Based Health Alliance in Washington, in December. Our team is part of the National Quality Initiative, and we've got a big group coming, and we're really excited about that. Folks I think are feeling a little bit, maybe a little anxious, maybe a little overwhelmed, but excited at the same time. And one other exciting thing was that we have a statewide legislatively mandated School-Based Health Center Advisory Committee with required representation from a number of state agencies and all different kinds of sponsored school-based health center organizations. And we passed the definition of a school-based health center in statute last year. And we have developed minimum standards for school-based health centers in Connecticut, and we were not able to get that in as part of the bill. It said that our commissioner may adopt it, but it didn't say that she shall. Yesterday we had a great meeting with some folks from regulations at the Department of Public Health, and they are really in favor of getting this through. And they're going to really do whatever they can to help us get these minimum standards passed through into regulation, which means that school-based health centers would have to meet these minimum standards in order to be a school-based health center. So this puts some structure to something we've been working on for a really long time. So we're pretty excited about that. Our downside is that our state budget is a mess, and there are going to be additional cuts made to our existing state dollars in this fiscal year. And depending on whether you look at the governor's budget, who wants to cut $437,000 from school-based health centers, or whether you look at the Democrats' budget, who want to cut $234,000, either way, it's not a pretty picture. And we're having to hop into advocacy mode so much earlier than we normally would. Our session doesn't normally start until February, and they're in special session now, trying to resolve it. So it's adding a layer of work to our advocacy that is much earlier than anticipated. So that's where we are in Connecticut.
That's great, Jesse. And our enthusiasm for your team participating in the National Quality Initiative matches, hopefully, your enthusiasm to come down here. We're very excited.
Thank you.
Does anyone else want to volunteer next? Maybe Julie? Or Kim?
Sorry, I thought I had hit unmute when I was talking. I apologize. This is Kim from New Mexico.
Same with me. Go ahead, Kim, and then I'll go after you. This is
okay,
I was
sorry.
on mute, too.
I was just talking. So yesterday, myself and our executive director, Nancy, who should be joining the call a little late, we spent all day at the Legislative Health and Human Services last committee meeting before the session. And we were able to have them endorse a bill for increasing funding to school-based health centers by about $500,000. So not that means that it's going to go through, of course, because our budget situation is a mess like a lot of the other states, but we were pretty happy about that and the support that we had from a lot of those legislators, and it seems fairly bipartisan, too. So I'd say that's our awesome for right now. So we're gearing up and working already for the session, and we're getting our materials together and all of that. So
I was wondering, I was like, is that window open? It was so, like, right here, right?
Okay. Should I go next? This is Julie.
Sure, Julie, that would be great.
Okay. I'm calling from Philadelphia, and as I started to say, I apologize, but I have to get off the call probably by like 1 to be at a school. But we are busy working on expanding our first school-based health center to serve the community in a promise zone. We got a state grant to do some renovations and build some exam rooms, and are busy doing lots of things to expand and implement the full community health center. On the state level, we still don't have a state budget either, and it's really, 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 really bad for schools and especially for nonprofits. But it sounds like there's probably an agreement that's going to be hammered out in the next couple of weeks, but it's been pretty bad. But we have, we've begun reaching out, we don't have we're the emerging affiliate for the Alliance. There isn't really a big consensus or connection between school-based health centers in the rest of the state. I've talked and met with just one in Lehigh Valley, but so I have some vistas working with me, and they've been reaching out. Actually, this morning got through trying to call all the those that are listed as members, and so we'll see what the response is. There's about 20, so I'm hoping that with the new governor, with a new secretary of the Department of Human Services in the state, that we can really start to convene all the state, all the school-based health centers across the state, and try and make some progress of support at the state level for school-based health centers. So that's it.
Great. That's great. And Marcel?
Hi, this is Marcel. I don't know if I'm allowed to participate since I'm not a state leader. I'm here for the communications piece at the end. I guess I can share, in Serena's absence, I can share one great thing that's happened for us is we've got a lot of momentum in the Central Valley region of California, which is an area where there's a lot more transportation challenges because the distances are really vast. And there's also a lot of unique health challenges that face children there, like asthma, because the air quality has really been affected by the drought and also by the geographic features of the valley. The air doesn't tend to move. Anyways, we have received a grant from a community foundation in Fresno to work with, I think, 6 or 7 school-based health centers, or maybe more than that, a handful of school-based health centers, less than 10, to work with schools on an early childhood initiative. And so it's going to be kind of building partnerships between school-based health centers and child care providers and community organizations that work on children's development, like First Fives, and really trying to get school-based health centers looped into, being seen as a way to improve children's health and well-being and really help them get a boost on their early education prospects. So that's some really exciting news. And then we've also just got in general, that grant itself is indicative of some bigger growth and momentum happening in the Central Valley. I think that Fresno Unified School District, which is one of the larger school districts, I think is maybe on the cusp of starting some new school-based health centers, and there are some other school-based health centers that are kind of getting off the ground or in the planning stages. So there's a lot of good news kind of coming out of that region where there is a lot of need for this model.
Marcel, that's really exciting news.
Yes, it is. It's our awesome. That's the awesome I'm reporting. I don't know. Serena may have had a lot of other stuff that she might be able to share, but that's the next call.
Absolutely. All right. Is there anybody else on the phone who might not be logged into the system who wants to say hello and share something from their state? Okay. I'll assume not. So we're going to move on to committee updates. So I wonder if someone, a representative from each of the committees, the communications, the SVHC standard and measures, and the telehealth committees might be able to share a bit about any progress or reflect on the discussions that they had last month with the group. Perhaps we'll start with communications, and communications can give an update.
Yes, this is Marcel again, and we have drafted a fact sheet, and just to back up, our goal was we wanted to have some shared statistics and language around education that kind of focuses on the benefit of the school-based healthcare model for educators, so that we all can kind of draw from it and customize it, but also have some language that we're all kind of using when we're talking to an education audience about the, like how school-based healthcare kind of can work with education leaders to improve education outcomes. So we have drafted a fact sheet, but I think it's kind of a first start. So I'm hoping that folks can join, folks who are in that group can join at 10 o'clock, and we can think about next steps. But I feel like we're making progress, and I think there's some other good things that we can be moving forward on the call. Thank you.
That's great, Marcel. Is there anyone on the call today who has been working with the SBHC Standards and Measures Committee who might want to give an update on where you are?
This is Heidi. I'm on the committee, but I haven't been able to attend maybe the last 2 months call, so I couldn't give an update. I apologize.
No worries. Is there anyone else on the call who's been a part of those discussions in the past 2 months?
No.
All right. How about telehealth? Has anyone, is there anyone on the call who's been part of the telehealth discussions? All right. Well, good work on the communications committee. Thank you for the update. And then when when you break off into committees this afternoon, hopefully you'll have productive discussions, and we'll look forward to the updates next month.
Haley, could can the people on these committees, are they only state leaders, or could they be others? Like, I'm thinking of my communications coordinator might be very interested in being on the communications committee with Marcel. Is that possible, or you just want state leaders on that committee?
This is Marcel, and I would love, is that Emily?
Yes.
Yes, please have her join, please, because, and I'm sorry because I haven't reached out. We had been doing we had an informal communications group that she was part of, and we it broke apart. People couldn't find a time to talk, and I've asked Kevin Lionel from Michigan to join this call, and I've also asked Andy Kreis from the LA Trust, which is our partner who works just in LA Unified, but they have so many school-based health centers there, to join, though I haven't asked him to join this call. But if she can join, that would be great. And you guys are so fast forward on the communications front. You all do amazing work, and so I think that it would be great. So I don't know if I'm breaking a rule by saying that since I'm not a state leader, but I would love if we had, for the groups that have communications capacity and have folks who are doing this work, I would love for communications people to join. And I'm not a state leader, so.
This is Andrea. One of the things we sent out in the scoop this week was to ask state leaders to complete which committee you are on. So I think in this instance it does make sense, and I don't know if there's any, I like Martha, I don't know if there was a history on what the charge was with this. I don't know if Haley, if you have any insight on it, but if we are going to move beyond the state leaders themselves being on there, I would just ask that state leaders, when filling out the survey, then indicate who their designee would be on that particular committee, because we're trying to get a list of all the contacts per committee. Do you know, Haley, what the original charge might have been on the committee formings?
And some of the state leaders might be able to contribute to that
Yeah.
better. I don't know if I think my instinct would be to say let's bring the communications individuals in if that's going to make these committees most productive. It sounds like a fantastic opportunity to bring people together nationally, unless from the state leader perspective there's some reservation about maintaining this space exclusively for state leaders. So does anyone have any thoughts or perspectives they want to share, just so we can be sensitive before making any decision?
This is Jessie. I personally don't have enough knowledge. I think I was not able to be on the call when we first started talking about these committees and things, and I'm not on one myself. But I don't know if that skill set for communications in particular is necessarily a skill set that the state leaders would have. But if we're fortunate to have someone on our staff that does, it makes sense to me to have that person be a part of it as opposed to someone who doesn't necessarily. I mean, we might weigh in, but we may not have that skill set.
So Marcel, our communications manager, Kyle, who as I understand most likely participates on this committee, is currently out of the country for another week. And so I'd just like to follow up, I guess, with Jessie to make sure, or even as Andrea said, if individuals with communications people can make sure that they share that information with us, we would love to invite them into being a part of that communications committee, so we can make that the most productive work. And all I know from the perspective of the origins of these committees was the idea to create bodies of work that would be owned by the state leaders themselves, that they were driving the agenda and working together. So as long as it makes sense to all of you guys, it absolutely, I think, makes sense to us to bring the best people to the table to work on those committees. Share those names and emails with us if you don't mind, for Emily, Kevin, and Andy, and anyone else who has a communications staff to perhaps send that our way. And we'll make sure that communications come out to those individuals about joining for that committee.
That would be great. And this is Marcel, and not just putting it out there. One of the reasons why I haven't kind of gone and invited more is I never have the call-in information for the 30-minute call that starts at 10 until the end of this call. So if that information can be shared, I feel like I don't have it anywhere. I always just like dial it off this screen at the end of this call. I've never written it down though. I don't know if it's the same all the time. So I feel like I'm a little out of control in terms of being able to extend an invitation, and then also it may not be in my place if that's kind of not what we wanted to do.
The numbers are the same every time, and we can make sure that it doesn't feel like you're out of control, that you have access to
Thank you.
numbers. We'll share those.
Okay.
All right, fantastic. Any other final thoughts before we move on to the committee to the School-Based Health Alliance updates?
This is Stephanie. I just joined. I'm late getting on, but I'm here now.
Hi, Stephanie. Welcome. Is there anything you want to share? Any update from your state, or any awesome personal or professional?
No, it sounds like you just went through committee updates. So did someone do the standardized evaluation stuff, or do you need me to give an update on that, or did someone already do that?
So, I'm confused.
On the committee.
Yeah, fantastic. Yes, if you could give a, sorry, I got confused with it for a second. If you want to give an update on the SBHC standards and measures in your discussion last month, that would be great.
Yeah, so one of the things that we noted on our subcommittee was that we had a completely different group of people on our second subcommittee call than we had on our first subcommittee call, and so it prompted us to go and ask the question, who's on our committee, and do we have email contact for them? And then I think that's what may have prompted the survey that you guys sent out recently. They sort of get people to acknowledge which committee they were on, and so that we can, those of us who are chairing subcommittees can do a better job at reaching out to our committee members. So that was kind of one of the issues that we talked about, tackled last month. And then we, 2 months ago, we had talked about having people Dropbox any tools that they currently use to tell their data stories in their state. I think Tammy just checked that like a week or so ago, and there wasn't anything that had been dropped into the Dropbox yet. So if states have tools that they're using to sort of tell their stories through data that they wouldn't mind sharing in the Dropbox, that would be awesome.
Great.
You know, for some folks, I think it looks like an annual report. For others, it looks like a data summary sheet. So it can just be whatever you're currently using in your state to tell your story with data.
Great, thank you. Thank you for the update. And yes, we encourage everyone to share into that Dropbox. And if you have any questions about how to access that Dropbox or how to put data in there, Stephanie, can they contact you?
Sure.
Okay, fantastic.
Stephanie, what's your last name and your email?
Daniel, and my email address is sdaniel@wakehealth.edu.
Wade, W-A-D?
Wake, W-A-K-E.
Oh, Wake. Okay.
Health.edu.
Okay, thanks.
Hi, Stephanie. This is Andrea again. One other quick question. Are you talking about a Dropbox, a separate Dropbox, or are you talking about on the state leaders forum on the website?
Yeah,
okay.
On the state leaders forum on the website.
Great. Okay.
So Stephanie, if you can confirm that this is your email address, I've just chatted it to, I probably should have chatted it to you first before I sent it to everyone, but is this right? sdaniel@wakehealth.edu?
That's correct.
Okay, fantastic. So there it is if anyone wants to mark that down and share it with, share any resources. All right, great. Thank you for those fantastic state and committee updates. It's great to hear everything that's going on. So we're going to move along to School-Based Health Alliance updates. I'm going to start and turn it over to my colleague and intern, Anna Mitzi, who's working on an innovative finance case studies project, and she's going to share a little bit about the work and engage all of you in a discussion about some of the work that might be happening in your state. So Anna, I'm going to turn it over to you.
Afternoon, is everyone there? Can everyone hear me?
Yep, we can hear you.
All right, great. So like Haley said, I am working on an innovative finance case study. And so the goal of this is really just to give some practical steps for the centers and for the state affiliates to implement some financing mechanisms that maybe haven't been considered before. So we decided we're going to look at 4 mechanisms, the first being impact investing, and then dedicated levies, wellness trusts, and some funding from the Hospital Community Benefit Fund. Now, we're going to look at different things with each of these. With impact investing, since it's sort of new, we're going to focus more on exploring the mechanisms and the different kinds of funding that exist and the different opportunities. With dedicated levies, since those are a little bit more self-explanatory, we'll be looking at how to manage those partnerships. With wellness trusts, since those are also kind of new, we'll be looking more at definitions and, again, some opportunities. And then with the hospital community benefit, we'll be looking at some of the new legislation around it, because I know that there's been some confusion as to what counts and what doesn't, and some opportunities for centers and for state affiliates to get involved, especially with the health needs assessments and implementation reports. So that sort of covers what I'm doing and what we're working on, but I want to open it up to everyone to find out what you know, don't know, would like to know, what you've seen insofar as these mechanisms or any other really cool, financing options that you guys are seeing.
This is Jessie. I actually have a question that I don't know if it necessarily can be answered, but I'm very curious, as we're seeing a lot of hospitals in Connecticut that are merging with much larger let me go back. Nonprofit hospitals in Connecticut, a lot of them are being taken over by much larger for-profit hospital systems. And once that happens, it's no longer a not-for-profit hospital. Are they still required to do the community benefit piece? Do you know?
Yeah, so the quick answer on that is essentially no. What ends up happening, and this is something we toyed with speaking about a bit, is they have to create essentially what's called a hospital conversion foundation. And so they have to sell off a certain amount of the assets from the nonprofit based on how big they were and what their requirement would have been. And that has to go to nonprofit. But that's sort of a one-time thing.
Okay. And that's a requirement because they were nonprofit before?
Yeah, that's a federal requirement.
Okay, that's helpful. Thank you.
So has anyone seen any of these four or any others being used in their state?
I've seen impact investing, not for school-based health centers, but more so for like capital things where, a nonprofit that owns a building and needs to have a boiler replaced, or for building just capital expenses. But I thought about it for investment to be able to afford the infrastructure in 1 year to get to the next level. It's like we're always playing catch up and can never really put the resources that we need to into infrastructure to support data collection and evaluation and communications and all that stuff. That's so critical, and we're not going to get to phase 2 without that, but we can't afford it. So I think about that of having an infusion of, or a loan basically. Is that what you're talking about? Like where foundations using the 95% of their assets? Is that what you mean by impact investing?
Yeah, that's part of impact investing. So it's a broad category. So it's essentially any point where an outside private investor gives funds in a variety of ways to a nonprofit. So that can be that kind of capital investing that you're talking about. We're hoping to look a little bit more at more of the bond investing, where you have a more long-term commitment. But it'll really depend on what's out there in the field.
Yeah.
So, given these four, does anyone have any questions? What would you want to know about these four if you were going to try and implement them? And if you have tried to implement them in the past, do you have any insight into what's kept you from doing so, or what's kept the centers from doing so?
Hi, This is Marilyn Crumpton from Ohio, and if I understand the impact investing that you're discussing, that's something that Interact for Health has done in Cincinnati, and so they provide an investment like generally a $200,000 to $400,000 investment over the first 2 years, and that is to create the startup funding. So they make a business plan with whoever's going to open the school-based health center that you have to have an acceptable sustainability model in order to get the funding. Is that what you're talking about?
Yeah, like I said, it's a broader category, that one. So what we end up looking at is really going to be based on what we find in the field. And so far we've seen a lot of that kind of cash flow investing. There are only a few of what we would call social bond projects, like in New York. There are a few in Massachusetts. And I think there's one that they're starting to try and get going in California right now.
Hi, this is Heidi. I would be really curious to know, for those few that you mentioned that are implementing more of that social impact bond model, what types of outcomes they're tracking, or what metrics they decided to use for that type of arrangement.
What type of metrics to measure?
In terms of like whether or not the project was successful. So the way, okay. So I'm thinking, if you identify any, I don't know if this is happening within the school health center field, but typically, right, with social impact bonds, you would have an investor and whoever's doing the actual implementation of the project come up with a plan, an evaluation plan, and if the project meets the goals, then the investor gets paid, they're an additional, in addition to whatever they invested, assuming that there are like cost savings to the program or the project that was implemented. And if they don't meet the goals, they don't get paid out. So if you found some kind of arrangement like that with school health centers, I've heard of, some social impact bonds being used for in the criminal justice system. I'm not sure. I'm thinking a lot of with young people too, like asthma. I think some asthma projects maybe in California, but I don't know that I've heard of anything specific to school health centers. So if there's something like that and they've figured out some metrics that they're tracking for their project, that would be interesting.
Okay, great. Yeah, we can definitely look at that.
And Heidi, this is Haley, and I'm sure some of the other state leaders are aware of this and perhaps know more than myself, but I would really encourage you to reach out to Margie Rogers with Montefiore in New York, because they have been working on a social impact bond, and they have two. One is around the prevention of teen pregnancy, and the second is around reduction of hospitalization due to asthma, directly related to school-based health centers. So she might be able to fill in fill in a lot more interesting depth to what they've done and how they're doing it in New York.
Cool, thanks.
And if you don't have her contact information, feel free to send me a quick email and I'll send it to you.
Sure. Great, thanks.
Great. Does anyone else have any questions, anything that they would look to be trying to get out of this kind of study before we wrap it up?
Hi, this is Nancy in New Mexico. I'm sorry I'm joining late. We just found out yesterday in New Mexico that our primary care association is working with the legislature to look at sharing the hospital community benefit with FQHCs, and a lot of our school-based health centers are sponsored by FQHCs, so I'd be interested in knowing maybe not specifically what other states are sharing that hospital community benefit with school-based health centers only, but also if they're sharing with FQs who then sponsor school-based health centers, so it sort of trickles down. So just wanted to add that.
And would you be more interested in sort of the Shaw side, how that partnership is managed, or more in the legislative, how that actually works?
Probably the former. It sounds like I could probably find out about the legislative process if it happens at all in our own state through the Primary Care Association. I know for sure in our state the hospitals really don't want to let go of it. So my guess is that our Primary Care Association has had to work for a long time with the hospital associations folks to even consider it. So I'd be more interested in, once it is legislated, how it works and how it gets passed down so that it actually gets to the school-based health centers.
Great. Thank you so much for your input. I know, just quickly on that, the way that partnership ends up working, from what I've seen, tends to be very individualized through the system, and there tends to be sort of the person who heads the hospital community benefit at the health system, and then the person that's in charge of disseminating the money either in the health network or through a government office. So I can definitely look through the study at, sort of the pros and cons of those relationships and how other groups have managed those relationships before.
That would be great, and I guess it didn't occur to me earlier, but after you just described that, if anybody actually indicated, in the legislation what the language is about sharing with school-based health centers, that actually would probably be helpful to have all of that in one place, just so that if legislation does move forward here, we could maybe play a role in sharing best practices around that.
Great. Thank you so much for that input. So I think if nobody else has any other questions for me, I'll turn it back over to Haley. Thanks, everyone.
Thank you, Anna. All right, we're going to switch gears and share a few updates from the research and evaluation team. The first piece of news is my bit of happy news, which I haven't had the opportunity to share with many of you yet, but that's that I'm expecting a baby, a girl. She's due on December 25th, so it could possibly be a very exciting Christmas in our house this year. But yeah, we're really excited about this, and I'm going to be off for a couple months with the little one, but and Erin Scheller, who I'm going to turn it over to you very briefly, our research and evaluation manager, is going to be your direct point of contact for all questions related to the census and the mapping project. But I look forward to being back sort of March, April time, and just want to share that news with you.
Congratulations.
Congratulations.
Very exciting.
Yeah. Thank you. Thank you. All right, so I'm going to switch it over to Erin, and she's going to share a few updates about the 2013-14 census and the Children's Health and Education Mapping Tool.
Thank you, Haley. So there's been a long-awaited announcement about the specific date that we'll be releasing the latest census report, and I'm happy to share that that will be in early 2016. So we're planning to launch the report on Thursday, January 7th, so you can all look in your inboxes for an email and lots of communications about that when it finally comes out. We really appreciate all of your help along the way in getting such a high completion rate. As you all know, we got 82% of all the school-based health centers reporting data for this latest census. And I'm also excited to share that our team has been working hard on giving the report a bit of an updated, fresh look. So this time we're planning to have a digital report which will feature some stories to really bring the data to life. and some interesting graphics. And we'll also put out a 4-page brochure, which will be also available as a PDF and the type of publication that we'll have available at meetings and things like that, and that you'll be able to easily take with you for advocacy purposes. We will schedule a webinar soon to announce our findings, as we've done in the past, and we'll also be sharing data with states that got a 60% or higher census completion rate. And looking at the list of those of you on the call, I think that is most of your states. So congratulations on that, and we will look forward to sharing that with you and hoping that you might use the data that you all worked so diligently and hard to collect over the past year. Are there any questions about the census report or timeline?
Nope.
Wonderful. And next we have our Children's Health and Education Mapping Tool. And I think that many of you have heard about this when we did a demo, gosh, back in July, I think, on a state leaders call. But for those of you who are new or unfamiliar, this is a mapping tool that's been in development for a few years. We're really excited about this because it will allow sites to see their actual school-based health center on an interactive map. So this will be a platform that will be freely available to everyone, and we're going to have lots of different trainings about the tool, but it will have data on school-based health centers as well as on public schools, and then some characteristics about each of those that people will be able to filter on. And there's also a layer that will allow sites to find out and other stakeholders to find out a little bit about children's health, education, and socioeconomic indicators in their counties. This is a little snapshot of what the map looks like. The green dots on here are all the school-based health centers, and the different colors are where it allows layering to see high-need counties. So we're really excited about the potential for this and appreciate those of you who participated in the pilot process. And we will be launching this on the same day as the census because we feel like they really go hand in hand, since this will be an exciting new way for those who are interested in the census data to see it come to life and interact with it themselves. So as I mentioned, we will have a variety of webinars and trainings about this mapping tool along the way, so you can stay tuned for links to register for those. We are having a School-Based Health Alliance members-only sneak peek at the mapping tool on December 17th at 2 p.m. So I'll send out another link for that for those of you who are interested in participating. That would be wonderful. And we look forward to engaging you all with the tool as we learn how it's been useful for you, how we can continue to improve it and our communications about it, and are hopeful that you might be able to circulate this to your networks as well. Are there any questions about that?
Nope.
Great. Well, we look forward to sharing both of these resources with you in January.
Hi. Hi, I'm here for the Health Center.
Thank you, Erin.
Sorry.
Andrea, I want to ensure that there's time that at 1 o'clock that there's time for the committees to break out and have their sessions together. Andrea, do you want to start a brief discussion about youth engagement?
Yes, thank you. And I actually have only needed 2 minutes anyway, so we're perfect timing. I just want to let everyone know if we will continue to send out the survey that came out with the scoop this week, but I really urge if you would take the time to complete the survey. One, it asks you which committee you're on, as I mentioned earlier. Additionally, it asks if you have a youth advisory council at your with your state organization, and we have worked with some of you in the past on collaborating between our Youth Advisory Council and yours, and wanted to get a little bit more of an official tally of who does have, and then we'll be reaching out to those who do to see if there's some ways we can collaborate even more so as we are gearing up for selecting our upcoming year's Youth Advisory Council here at the national level. One of our ideas is around, depending on the numbers of Youth Advisory Councils that do exist with the state affiliates, is to potentially test out it and get your feedback on the model of seeing if there are youth to nominate from one youth potentially from each state affiliate to participate on the National Youth Advisory Council as well. So we'd like to brainstorm some of those types of ideas with you all and see if there are ways we can better collaborate our youth engagement work that's happening at state and national. So if you could complete the survey, that's the place to start, and then we'll reach out to those of you who are engaging youth actively at the state level. And that's it for me. Thank you.
Thanks, Andrea. All right, so we're going to turn it over now to you guys to all break out into your committees. I think, as Stephanie suggested, that I think there's some movement in between committees, and maybe since this is a new structure, people are still finding their home in which committee they belong in. If this is your first time joining a session and you don't have a committee, then you can pick one of these 3 conversations to join. There should be a leader, a host for each of these things, but we will we'll hang up the line here through the GoToMeeting, and you'll dial in using these numbers for the breakout conversations with your committee. So unless anyone has anything else to share, we'll just say thank you so much for joining this afternoon and for the really rich discussion, particularly around Anna's innovative case studies. That was a lot of really good information, and for your updates as well. So thank you, and we will talk to you next month.
Bye.
Bye, everyone.
Thanks, Haley. Bye-bye.
Bye-bye.
I'll leave these numbers up on the screen momentarily so folks can call in.